Jeremy Daly joining us in studio. He's a physician assistant at Tripp Family Medicine in Twin Falls. And actually, his topic today is one that I well know because, Jeremy, I have had issues with reflux, I think, since I was at least a teenager and going back many, many years. And I think part of that is because I had a stenosis in my digestive tract that was fixed when I was probably 2 months old.
Pyloric stenosis, I'm assuming.
Yeah. And I've got a couple of big scars from that. Well, one from the staples. And then, the scar was tiny when I was 2 months old, and then it grew with me, which is funny how that works. But now I've got a big half-foot long, scar. But I've had the reflux issues, and over the years there have been a number of innovations and things that have been done that have obviously helped people with this. I remember there was a pioneering surgery going on. I know this because I was looking into it. Lee Memorial Hospital in Oswego, New York, almost 30 years ago,
Hmm.
where they were cutting 4 small incisions and then going in and they were pulling a muscle around to try to close that sphincter.
Hmm.
And then we ended up coming along with Zantac and then some other medicines too as well that help people out. And then just some regular dietary changes. But I'm going to guess that a huge part of the population knows exactly what we're talking about.
A huge part of the population. Yeah, it's yeah. I think the statistic is 7 out of 10 people in their lifetime experience some kind of acid reflux, whether that's a chronic issue or an acute issue that they deal with for maybe a few days or a few weeks at a time, and then it's gone. But pretty much everyone knows what it's like, or knows someone that's had acid reflux, and knows that it's pretty uncomfortable.
Some people think it's milder. When I was younger, I could get away with taking a Tums or an Alka-Seltzer, and that would pretty much clear it up. But I remember it would be some things that would set it off. Like I would sit down and eat pancakes, and I think the syrup likely was doing it. And if I had pancakes, that was usually my Sunday treat. And then by Sunday afternoon, I would just be miserable because of it. Uh, and milk was a temporary relief, but then the acid in the milk builds up, and half an hour later, you're back to the same situation. So, we have had a lot of changes, and there are a lot of these medicines that people are buying, but we probably have some cautions about those too.
Yeah, there are some cautions, and some that are warranted and some that are not as warranted. There's been a lot of uh, research and especially media reporting on some of these medications, specifically the PPI class of medications, the proton pump inhibitors that we all probably are familiar with, medications like Nexium and Prilosec, the purple pill,
Mhm.
things like that. People usually have an idea of those types of medications, which those medications are excellent in what they do, and they can really not only help you to be more comfortable, but for a lot of people, it can actually save their lives, which is kind of an interesting thing about acid reflux, and understanding that if it is a chronic issue, can cause changes to the lower part of the esophagus that eventually can lead to what we call adenocarcinoma, or a certain type of cancer of the esophagus. And some people, they start with just this chronic reflux that is bothersome, and they manage with things like Tums or Alka-Seltzer, or
Mhm.
these over the counter kind of buffering medications, and they try to change their diet, and sometimes that works. And the research is kind of uh, it's not inconclusive, I guess you could say. It's that it really depends. That it's not a blanket. You can't have pancakes and syrup and milk, or else you're going to have reflux, because some people can have spicy food,
Mhm.
which a lot of us really feel like, oh yeah, if I eat spicy foods, that's when I really get reflux. But for some people, that's not the case. They can eat spicy foods. They could have a jalapeno and not end up with acid reflux. It's certain triggers for certain people, and so it's not a blanket recommendation that we give. It's hey, these foods could cause reflux. I mean, we talk a lot about medication, as far as, well, in terms of there's medications that we prescribe that can cause reflux, but things like methylxanthines, that's a class of medication. We don't use a lot of them anymore, but that includes caffeine. Um, One of them we used to use for asthma a little bit more, but we don't. And those have been associated with worsening reflux, but we don't see that in everyone. The same thing with mint.
Right. I cut down over the years on things. I
Hmm.
used to drink a lot of soda pop, and I also cut down on coffee consumption and the like, and that seems to have helped. It's smaller meals sometimes obviously help,
Hmm.
but it I had an aunt who was an RN. She knew this stuff inside out because of her profession. The esophageal cancer took her life last year at 70, and it drives it home that she might have, on her own case, gotten treatment earlier, but on the other hand, because of her age range, a lot of it hadn't been available when she was younger.
Right. Yeah, and that's the sad thing about these medications. But the good thing is they're available now to a lot of people, and over the counter availability it allows people to get a hold of them if they need it. The only caution that I really give people when it comes to acid reflux disease is sometimes we're thinking, oh, this is definitely acid reflux. We have these symptoms, but it's not always the case.
Hold on to that thought, and we've got some telephone callers too. Callers, we're going to take a short break, but be patient if you've got a comment or question about this subject. And I'm sure the about few thousand people listening this morning know what we're talking about.
Right?
Stick around. We've got plenty more coming up with Jeremy Daly from Tripp Family Medicine right here in Twin Falls. Jeremy Daly is a physician assistant from Tripp Family Medicine here in Twin Falls, joining us this morning. We're talking about uh, acid reflux and esophageal issues. Some of you people, obviously, which we used to just commonly call heartburn.
Yeah.
Some people listening out there might have a question or comment about this, and you may be in that point where you're ready to throw in the towel, and you might be looking for somebody to point you in the right direction on how you can get rid of some of this discomfort. We are at 70 degrees right now, and Bill Colley with you as well this morning on News Radio 1310 KLIX and News Radio 1310.com. But we call the segment Better Health with Tripp Family Medicine. Caller, you're on the air. You're up next.
Good morning. I have heartburn real bad sometimes, and I guess especially during election season. Um, but I had a Hispanic man one time tell me that from a heartburn, a tablespoon a day of apple cider vinegar will help. I tried it. It works. So why does adding more acid to your stomach settle your heartburn?
It's a good question. So one of the theories behind that is when when we have more of a basic stomach. So, you know, one of the main purposes of acid, we have hydrochloric acid in our stomach, and it aids in digestion, right? So some people they're underproducers of acid, and you may just be one of those people. So when you underproduce acid, sometimes you have food contents that stay in the stomach longer than maybe they should, and because of that, you can have a greater chance of reflux happen. So in people who have lower pH or higher pH, I should say, more basic stomachs, they may benefit from something like that. But I wouldn't say that that's a blanket treatment for everyone. So some people they could do well with that by lowering the pH and making it more acidic in the stomach. They may digest food a little bit better, and so heartburn is improved or resolved because of that. But not necessarily always the case.
I was yesterday. I was chewing on some pineapple cubes. I love pineapple, but I have to admit, pineapple doesn't love me, and that's very acidic as well. And I think that's what kicks this off. Uh, beyond, you talk about these treatments. Beyond that, are we still doing any surgery for people who've got these issues?
That's a good question. So, there's a couple of surgeries that are available out there. So, it just depends on what the underlying cause is. So there's cases where people will have what's called a Nissen fundoplication done, where basically they wrap the top part of the stomach around itself, and it keeps reflux from happening. And really, that's limited to people who have something called a hernia, so a hiatal hernia, where you actually have the stomach slide into the chest cavity, and in that case, it's indicated. There's some other treatments, but they're not quite as um, worth it. We should say. I mean, they're available, but you know, there's things like medicine that are way better, lower risk. You don't have to go under the knife to have it done, and so it's a good thing to try.
I know that if you read the label on a Prilosec or Nexium container, though, they refer to it as a treatment, and they refer to 14 days. In other words, it's not supposed to be the be all end all day after day, month after month, year after year.
Yeah, and that really is case dependent. Some people they can do a course of the Nexiums and do well. And as far as the FDA indication goes, it's about 8 weeks of treatment that they recommend you do. And after that, it remains to be seen. So why do we continue to keep people on medications like Nexium after 8 weeks? Well, after 8 weeks, we discontinue the therapy and they're still having uncontrolled acid reflux. Well, what's the risk? Well, we talked about Barrett's esophagus or the changes that happen in the lower part of the esophagus, and that can be a problem. It can affect quality of sleep. I mean, really, what we're looking at is it going to affect your quality of life in the future through something like development of cancer, poor sleep quality for years, and there's a lot of people that struggle with sleep quality due to acid reflux, and you know, it's worth it. It's worth it for them to have good sleep quality versus just dealing with the acid reflux and
Mhm.
or minimal treatments. So the other things that we consider are, are there symptoms that necessitate more of a look than just a clinical exam where we say, oh, what do you have? What's going on? Look at the throat, listen to the lungs, a typical exam. And when people they can't swallow or they're having a difficult time swallowing, I should say, that's when we think, well, this probably needs to be evaluated a little bit further. So we will refer to like a gastroenterologist and they can do things like an endoscopy. And there used to be a lot more. They do some pH studies where they look at the actual pH of the esophagus and the stomach and see what the pH is over a few day period. And that can be helpful um, to determine is there something like a Barrett's esophagus, or sometimes people will get strictures or webbing that occurs inside the esophagus. And when that happens, it has to be stretched out for it to happen,
I
for it
also
to digest.
also have heard, a doctor told me this years ago, he said, it's not so much the spicy food I want you to avoid. He said, greasy food. So he said, things like a greasy slice of pepperoni will do it. That'll be worse for you than, the spices you might be eating. And so I took that to heart as well.
Yeah, and like I mentioned earlier, a lot of those are patient dependent. And so, we give kind of blanket recommendations sometimes and say, hey, these are foods that can actually worsen reflux. Spicy foods, fatty foods, mints, anything like from the mint family or peppermint can actually relax the lower esophageal sphincter that reflux happens because of, and cause reflux to be worse in some people. And it's just a patient dependent thing. So sometimes it's trial and error to say, does this cause reflux? No, you can eat it. Does this? Yes, you can eat that. So that's basically how we do it a lot of times.
I had a friend, he lost about 20 pounds going into the Army with all the exercise and the training that he did. And he told me once, he said, any problems he had with reflux went away with the weight loss. It just completely stopped at that point. Of course, the food he may have been eating at basic training might have been very bland too. Um, but he said he had no problems afterward.
Yeah, and there is a greater risk for people that have uh, uh, basically central obesity. So if we have we're overweight, obese, then that can increase our risk for having reflux as well. So, the thing that I caution people about all the time, because a lot of these treatments they're easily accessible, they you most of the time can figure it out on your own. Oh yeah, this is reflux. I'm gonna try this Nexium for, a couple of weeks, see how it goes. Oh, it took away my pain. Great, we're on track. Every now and then we'll get people who have symptoms that seem like acid reflux, but they're not. I had a case recently, um, really, really nice gentleman that thought was having reflux. And I heard his story, and some of it sounded like reflux, some of it didn't. The part that didn't is with activity, this was worse. And, we considered the possibility of a hiatal hernia that we talked about, the hernia up into the chest cavity, that sometimes, when you're breathing harder and there's more pressure in that cavity, yeah, maybe it could make acid reflux worse. Um, but I really counseled him that this was something that needed to be evaluated by cardiology. We needed to do a stress test to make sure this wasn't heart-related chest pain. And there was a lot of back and forth there for a while. Um, Several weeks, he came back in and checked back in on him, and oh, the reflux is better. I think this is just reflux, but I'm still having some of the pain, and I think it will go away over time. And in about 3-4 weeks after we had gone back and forth. He was like, "Oh, you know what? I think I think I'll take you up on that offer to do the stress test." So we did the stress test, and ended up being something that needed more than more than just a stent placed. It needed some surgery. There was just some artery disease, some coronary artery disease, and that's what was causing that chest pain. So it's important to note that if it's not improving with these types of treatments, it needs to be evaluated because there are a lot of things that mimic heartburn, and sometimes it's tough to differentiate. It's not cut and dry a lot of times, and so getting an opinion of a medical professional is a great thing to do when you're having symptoms like that.
Oh, yeah, I was in the seventh grade when one of my best friends, his dad thought he was having heartburn, went to bed, never woke up, turned out to be a heart attack. So
Mm,
there is that confusion sometimes that can be going on here.
exactly, and sometimes it's hard to differentiate something like that. I mean, who's to say that it wasn't going on for a while, or he wasn't having chest pain with activity and just not mentioning it to anyone. That's a really common thing, but those things are not typical of heartburn. If you're exercising or going up the stairs and you're like, oh, my acid reflux is terrible and I'm running up the stairs, well, it may not be acid reflux, and it may not go away with things like Nexium and Zantac and medications that we commonly recommend for reflux disease. So if that's happening, you need to be evaluated for sure.
Want to point out it's 8:52. Jeremy Daly is joining us from Tripp Family Medicine here in Twin Falls. Better health with Tripp Family Medicine. We're at 70. Bill Colley with you as well on News Radio 1310 KLIX and newsradio1310.com. We should point out if people would like to get in touch with the office, a number of ways they can do that.
Yeah, we have a great front desk staff, and we'd love for you to call them and get to know them. 933-4400 is our telephone number. Um, we work really hard to make sure that we with new patients get you in as quickly as we can. Sometimes as soon as the next day, if we can. And our same page, our existing patients, we get people in the same day a lot of times, and we really work hard to do that with our scheduling and shifting our schedules around to accommodate everyone that we can. Um, and you can get a hold of us on Facebook, and we have a website, trippfamilymedicine.com, and even on Instagram you can follow us and see the activities that we're doing. And we'll be at the Kids Fest this weekend at CSI, so come over and see us there. We'll be doing some face painting and things like that. So
we we've got to point out with esophageal cancer. Now, I've always been under the impression it's a death sentence. That unlike other cancers, that there's no once you have it, there's no way you might last a while, but is that true, or can people live a long life after having it?
that's a good question. It really depends on the stage of the cancer. I mean, sometimes we'll catch cancers early on, and they'll be minimally invasive. They're not at that point. They haven't extended to the surrounding tissues or the lymph nodes. They haven't spread to anywhere distant in the body. Um, so that really helps the overall prognosis. And there's a lot of excellent surgeons and surgeries that can be done to take care of those cancers. And it really depends on the extent of the cancer and how much it spread locally. But even um, the more advanced cancers, we're seeing that they're being treated a lot better now, and people are living longer because of the the radiation therapy, the just how sophisticated that is, and some of the chemotherapies that are available. Quality of life is always a trade-off, when it comes to things like that, depending on what kind of surgery has to be done. I mean, it can really affect the quality of life, but it's amazing what people live through nowadays.
When you mention that when you catch it early, are there any indicators would somebody know? I mean, is there a marker that would be obvious to them?
Yeah, so one of the things I mentioned earlier is difficulty swallowing. If you're having a hard time swallowing and maybe even regurgitating food contents after undigested food contents after you've swallowed, that's a sign that something's blocking the way, and that needs to be evaluated. Um, One of the things that we see with a lot of cancers is unexplained weight loss. So, if you're not trying and all of a sudden you're losing a lot of weight, that's a concern. That's not something that's normal. So that needs to be evaluated as well. So those are some of the things that we look for as far as kind of warning signs for people that may have esophageal cancer.
The numbers are only going up with all of these issues too, as I
They are,
understand.
they are. We're seeing a lot more reflux. We're seeing things that contribute to esophageal cancer, going to be smoking, alcohol consumption, all of those things in combination, which, both of those things can affect gastroesophageal reflux disease. The heartburn that we're talking about today can be affected by those vices. So definitely people who have that uh, triad going on, they're at greater risk for developing cancers. And so a lot of it is preventable. We catch the signs and symptoms early. We avoid the things that can contribute to developing cancers, like smoking and drinking, and get the acid reflux under control. And we can prevent a lot of these things. It's just the fact that a lot of people are like, "Oh, I'm fine. I'm fine. It's just heartburn. It's just heartburn." And it may be for now, but as time goes on and it's untreated, um, we we sometimes are looking at things like esophageal cancer, and it gets people that don't think they're ever going to have anything like that. So it happens.
We've got to wrap up in 30 seconds. Maybe we should mention the contact information again at Tripp Family Medicine.
Yeah, come visit us at the our location in front of the post office on Fillmore, 1411. And then you can get a hold of us at 933-4400, and we'd love to get you in and meet you and take care of your health.
I was going to say, always looking for new patients.
We are. We love to take care of people, so we'd love to have individuals and families and old and young. We like them all.
One of the reasons they're at CSI this weekend is they're looking at the size of the campus, realizing someday they may need that. Uh,
You can talk to Dr. Tripp about that one.
I want to thank Jeremy for dropping by. News is next from Fox here at News Radio 1310 KLIX and newsradio1310.com. And then after 9 o'clock news, State Representative Brian Zollinger, who's right now on trial by mainstream media. He'll be spending a few minutes chatting with us about how he's managed to turn that around into an advantage for his next political campaign.